If one dinner could pull your loved one a few precious minutes closer to their memories, would you try it tonight? Weight loss, choking, and no appetite in Alzheimer's are not just aging, they're distress signals families often miss. In this episode, the Senior Wellness 365 expert team unlocks 8 deceptively simple strategies you can use within 24 hours, choosing soft, protein-rich, swallow-friendly foods, plating with high-contrast colors so the brain recognizes meals faster, structuring small, frequent mini-meals, smart reminders for those living alone, the hand-over-hand cue to guide the spoon safely, and a practical tableside plan for dysphagia and choking. Every tactic comes with real-life examples to help you implement confidently tonight. If you want mealtimes to become safe, nourishing, and dignified again, subscribe, like, share, and drop a comment with your biggest mealtime challenge. Your question may become the next on-screen demo that helps thousands of families. The Golden Rule: Safety, Dignity, Adequate Nutrition. Every mealtime decision for a person living with Alzheimer's should rest on 3 pillars. 1. Safe swallowing posture, pacing, texture. 2. Dignity and autonomy choice, respectful tempo. 3. Adequate nutrition calories, protein fluids to prevent weight loss and frailty. Safe swallowing, set posture first, upright. 90. Feet grounded, head/neck neutral, good lighting, uncluttered table. Start at a slow pace, small spoonfuls with a pause to complete the swallow. Prioritize soft, moist textures, flaked steamed fish, minced meats with thick sauce, steamed eggs, pureed soups, porridge. Consider slightly thickened liquids if coughing occurs per clinician guidance. Avoid dry nuts, stringy greens, and thin soups with mixed chunks. Red flags: coughing, wet voice, tearing, or fatigue during eating stop. Adjust texture and seek clinical advice if it recurs. Dignity and autonomy. Before more intake, ensure the person feels in charge. Use the 2-choice rule to reduce overload. Would you like bean porridge with mashed fish or mashed yams with steamed egg? Present one item at a time on a shallow bowl with a small spoon. Keep prompts warm and steady. We'll go slowly after you swallow. We'll try one more small spoon. No rushing, no arguing. Praise small wins. You handled 4 spoonfuls on your own. Great job. When needed, use hand-over-hand caregivers. Hand lightly over the person's. Hand to cue scooping and bringing the spoon up while preserving the person's sense of control. Adequate nutrition. Instead of pushing one large meal, provide 56 small feeds day and add quiet calories. 12 teaspoons of olive oil/butter into porridge. Thick yogurt. Nut butter, a touch of honey syrup if intake is very low unless contraindicated. Aim for a soft protein source in each mini-meal: egg, fish, legumes, and adequate fluids daily. Example: Mama Ngozi 72. Previously, multiple dishes confused her and she refused meals. Using the Safety, Dignity, Nutrition frame upright. 90. TV off. 2 stable choices: bean porridge plus mashed fish, mashed yams plus steamed egg. Serve one item at a time. Small spoon, slow tempo. Enrich portions with 12 teaspoons oil and add thick yogurt between meals. After 3 weeks, she cooperated better, stopped coughing, and stabilized her weight. Hold these 3 pillars, and meal times become safe. Respectful spaces where nutrition truly gets in. Fixed rhythm, same time, same place, simple layout. A predictable meal rhythm helps the brain recognize eating cues faster. Build a repeatable daily script. 1. Same time. Pick 23 fixed meal times. Niji. 7:30. 12. 0. 18. 0. Use a gentle alarm and the same lead-in phrase. It's lunchtime, let's wash our hands. Post a meal calendar in view and tick a box after each meal to create a sense of completion. 2. Same place. Always use one dedicated table. Stable chair. Upright 90. Feet grounded. Aim task lighting onto the plate and avoid backlight. If the person gets disoriented, place a familiar anchor, a known pattern napkin, a small photo frame to help attention dock. 3. Simple layout, high contrast. Keep only essentials on the table. 1 plate, 1 utensil, 1 cup. Use high contrast platings a light plate on a dark placemat or vice versa so the food pops visually. Choose cups with a bold rim for easy targeting. Skip busy patterns and clutter. 4. Reduce distractions. Turn off TV, radio, silence phones. Close windows if street noise intrudes. Soft instrumental music at low volume is optional. Caregiver voice warm. Slow, short sentences. The goal is a quiet bubble around the table. 5. Opening closing ritual. Before meals, warm hand wash. Dry hands. Pull out the chair. Take 2 slow breaths. After meals, wipe. Tick the calendar box. Offer a specific praise. We ate right on time today. Well done. Repeated rituals help the brain anticipate and follow. 6. Troubleshooting. If wandering or getting up, invite back with a gentle cue. 1 more spoon, then we're done. Avoid pulling. If attention drifts, change the seat so the back faces distractions. And boost contrast, darker placemat, lighter bowl. Example, Mr. Adewale 78. He moved the table to a brighter corner, turned the radio off, used a white plate on a deep green placemat, removed decorative clutter, and set a reminder 5 minutes before meals. After 1 week, he showed sharper focus. Meal time duration dropped from 70 minutes to 35 minutes. With fewer mid-meal exits, a fixed rhythm doesn't just ease caregiver workload, it restores a reassuring sense of safety and familiarity each time the person sits down to eat. Foods and textures, soft, protein-rich, swallowable. Aim for food that is visible, spoonable, swallow safe, and protein energy adequate. Use a 3-layer framework. Base layer vegetables, fruits, whole grains. Vegetables cooked very soft pumpkin, carrot, cauliflower, mashed or pureed as needed. Fruits mashed, pureed banana, ripe mango, poached pear. Grains, oat porridge, well-cooked brown rice, soft noodles. Avoid hard intact kernels. 2. Soft proteins. The anchor, steamed fish, flaked, minced meats in thick sauce, steamed, soft-set eggs, pureed legumes, lentils, cannellini. Think moist, cohesive tender. A thick sauce coats pieces, keeping them together and easier to control when swallowing. Plant-forward options. Silken tofu in a thick sauce, pureed beans with olive oil, thick soy yogurt. 3. Liquids and thickness. If coughing, choking occurs, ask your clinician about slightly thickened drinks water, milk, thin soups. Use a cup with a bold rim. Take small sips. Pause to swallow before the next sip. 4. Quiet calories raise energy. Not volume thick Greek yogurt. Nut butter, hummus, soft cheese if tolerated. Stir 12 TSP olive oil butter into porridge soups. A touch of honey syrup if intake is very low. Avoid if contraindicated for diabetes or per medical advice. 5. Plating and portioning. Serve 1 item at a time in a shallow bowl with a small spoon. Keep pieces uniform. Avoid thin broths with random chunks. Include protein in every small feed. 56 mini meals day beat 23 large ones. Example, Amina 69, she was losing weight, taking only a few bites per meal. The family added a between-meal pureed bean soup enriched with 12 TSP olive oil. Dinner featured flaked steamed fish in a thick sauce over soft oat porridge, with thick yogurt for dessert. After 3 weeks, Amina's weight stabilized, energy improved, and meals felt smoother. Quick tips: check dentures, jewelry before meals. Keep a log of food's textures, reactions to find the best fit. When in doubt about swallow safety, stop and consult a physician speech-language therapist. Portion strategy: small, frequent. For Alzheimer's, appetite, attention, and stamina often shrink. The most reliable fix is smaller portions. More often, fix mini meals day instead of 23 large ones. Serve one item at a time so the brain isn't overwhelmed. Use a shallow bowl and small spoon to pace intake. Daily cadence anchor times 7:30, 10, 30, 12:30, 15, 30, 18. 0, 20, 0. Keep each feed 10-115 minutes, long enough to finish a small serve without fatigue. Between mini meals, add quiet calories. 12 tsp olive oil into porridge soups. Thick Greek yogurt. A thin layer of nut butter, or a thick smoothie as appropriate. Building the mini meals breakfast. Soft oat porridge plus steamed egg, half an egg. Mid-morning thick yogurt, 23 tablespoons. Lunch flaked steamed fish in a thick sauce, 34 TBSP plus mashed potato. Afternoon pureed beans with olive oil drizzle. Dinner minced meat in a thick sauce, 3 TBSP plus soft cooked rice porridge. Bedtime thick smoothie banana plus milk fortified soy. Sips only. Lowering caregiver load, choose meal kits ready to heat for 12 feeds day. Batch cook. Then portion into 1,150 Gs trays and label day time. Use Portion Tools standard spoon. 120150 ml cup to keep serves consistent. A 7-day rotation prevents menu fatigue. For those living alone, set phone alarms. Post a meal calendar and schedule video call reminders. Safety and adjustments with diabetes. Coordinate with the clinician for slow carbs, small serves, and limit quick sugars. Favor soft proteins plus healthy fats for satiety. If coughing, choking appears, slow the tempo. Consider slightly thickened fluids per guidance, and maintain upright 90 posture. Example: Chief Chinedu 81 large. Multi-item plates confused him. He often abandoned meals halfway. The family switched to single-item plates. 6 small feeds day. Added thick yogurt between meals, and used a meal kit for lunch to ease prep. After 2 weeks, he finished his serves consistently, stayed seated throughout, and gained 0.6 kg without feeling overfull. Small and often wins because it respects attention span, reduces decision stress, and steadily delivers the protein and calories that bigger plates fail to achieve. Feeding support reminders and hand over hand. When the person lives alone or forgets meals, build a multi-layer reminder system. Phone, smart speaker, fixed alarms, 0730, 1200, 1800 with a familiar cue. It's meal timelets, wash hands. A recorded family voice boosts acceptance. Wall meal calendar, tick a box after each meal. Post near the kitchen's light table. Visual and scent cues, place bowl and small spoon on a high contrast placemat. Gently warm food so aroma drifts. 5 and 10 minutes before mealtime. Remote check-ins. 12-minute calls, video to confirm seated food present, first spoon started. Hand over hand cues. Movement while preserving autonomy. 1. Posture upright. Feet grounded. Uncluttered table, one item at a time. Shallow bowl, small spoon. 2. Caregiver position, sit slightly to the person's dominant side, not face to face. 3. Contact, rest your dorsal hand lightly over the person's dorsal hand, no gripping. 4. Sequence together, scoop level, bring to midline. Touch the lower lip lightly. Pause so they initiate mouth opening. Fade your assist as they take over. 5. Breath and script. Well, go slowly, inhale after you swallow. Well, try one more small spoon. 6. Avoid no head tilting back. No pouring from the spoon. No pushing if they refuse. helpful tools non-slip mat, wide grip lightweight spoon, two-handled cup with a bold rim, soft clothing protector to reduce stress, hand hygiene before meals, if mouth sores, dental pain, adjust to softer, moister textures immediately. Troubleshooting, refusal anxiety switch to a familiar flavor, shrink spoon size, add low-volume instrumental music, tremor hand over hand at the dorsum, or try the less tremulous hand, cough, wet voice, stop, slow pacing, consider slightly thickened liquids, consult physician's speech, language pathologist if it recurs. Example, Mrs. Iphioma 76, the family scheduled video calls at 12 Zazr and 18 Zazrs to confirm seating. Her daughter provided hand over hand for the first 3 spoonfuls, then stepped back. Meals finished calmly in 2,025 minutes. By week 2, she was completing meals without agitation, and intake increased consistently. Reminders start the routine. Hand over hand restores the movement pattern together. They turn mealtime back into a safe, dignified habit. Dysphagia choking safety protocol. Priority number 1 is prevention. 2 is correct response when warning signs appear. Standardize a brief checklist and repeat it every meal. Posture and setup pre-meal. Seat upright at 90. Feet grounded. Head, neck neutral. Maintain upright for at least 30 minutes after eating. Uncluttered table. 1 item at a time. Good lighting. TV, radio off. Check dentures. Dental pain. Mouth sores. If present, switch to softer, moister textures immediately. 2. Pacing and texture. Small spoon, slow tempo. Wait for the swallow to finish before the next bite. Cut, soften, puree as needed. Aim for moist, cohesive, tender foods, which are easier to control than dry, crumbly items. For thin liquids that trigger cough, ask your clinician about slightly thickened fluids per guidance. 3 red flags: coughing, wet, gurgly voice, tearing, flushing or pallor during eating, drinking, prolonged oral holding, unusual fatigue. Stop immediately, reassess texture, tempo, log the event, and involve your physician, speech language pathologist SLP if it recurs. 4. If a choking episode occurs, stop feeding, keep the person upright, encourage coughing if they can still speak, cough. If you suspect airway obstruction, can't speak, cough, severe stridor, cyanosis, call emergency services and provide first aid per formal training. G. Abdominal thrusts only if you are trained. Do not give water or push more food. After the incident, notify MD SLP for a swallow assessment and adjustments to thickness level, posture, and utensils. 5 menu refinements. Prefer thick sauces that coat pieces, improves cohesion. Avoid thin broths with random chunks. For drinks, use a bold rim cup. Small sips pause, swallow. Consider slightly thickened liquids if recommended. Example, Baba Tunde, 84, he coughed with water and tea. After review, the family switched to slightly thickened liquids, used small spoon, slow pacing, and kept him upright for 30 minutes post-meal. Over 2 weeks, coughing markedly decreased, and the post-drink wet voice resolved. Remember, dysphagia safety starts with upright posture plus slow pace plus appropriate texture. Any recurrent abnormal signs warrant a professional swallow evaluation and a tailored plan from your care team. Monitoring and when to call the doctor. A simple consistent monitoring system catches early weight loss, dehydration, and dysphagia risk. 1 meal log. Record what, how much, when reactions. Note dish name. Portion estimate. Each G. 4. TBSP soup. Bowl. Porridge. Time eaten. And signs: cough, wet, voice, fatigue, refusal. Mark texture. soft, pureed, thickened, and beverage type thin, slightly thick. Note supports used hand over hand. Recorded voice prompt. 2. Weight and hydration. Weekly weight at the same time in similar clothing. Red flag. 23 kgs loss in 12 months or 5% body weight. Hydration count cups day. Watch urine color dark, ill, possible dehydration. Dry lips. Dizziness. 3. Cough, choke tracking log episodes during meals versus post-meal. Wet gurgly voice. Tearing or obvious blockage. Recurrent events adjust texture, pacing, and contact MD-SLP. 4. When to call the physician, MD. Persistent refusal, ill 3 meals in a row or 50% intake for A3 days. 23 kilo weight loss in 12 months. Dehydration signs worsening confusion. Scant dark urine. Orthostatic drop. Repeated choking. Prolonged cough after meals. Ongoing wet voice. Respiratory infection, aspiration signs, fever. Increased rate of breathing. Chest discomfort. Productive cough. Unusual fatigue. Oral issues, tooth pain. Mouth sores. Thrush, limiting intake. 5. What to bring to the visit, 7-14 days of meal logs. Weight trend. Medication list. Recent changes textures. Thickness level. A brief 10-20 SECI video of eating, drinking, if atypical signs occur. Cough. Gag. Example. Mr. Okafor 79 logs showed 10 days of 30-40% intake and wet voice after water. Called the physician swallow assessment. Switched to slightly thickened fluids. Boosted soft protein. Scheduled mini meals. 2 weeks later, intake rose to 70-80% and the wet voice resolved. Principle: keep record short. Clear consistent. Detect patterns early. Call the doctor at threshold triggers and coordinate with MD-SLP dietitian for plan updates. Early action prevents hospitalizations, protects dignity, and keeps nutrition steadily moving in. Teamwork in preserving autonomy. Safe, nourishing mealtimes in Alzheimer's happen when a whole team works in sync, while the person's choices and pace remain front and center. Anchor every plan to the triangle of swallow safety, adequate nutrition, dignity. Who does what? Physician MD diagnose. Adjust meds. Order swallow studies. Manage comorbidities. Speech. Language pathologist SLP assess swallowing. Prescribe textures, thickness, posture, and swallow exercises. Registered dietitian RD builds soft, protein-rich menus with quiet calories and a 7-day rotation. Nurse RN monitor choking signs, weight, hydration, coach caregivers on setup and pacing. How to coordinate. 1. 15-minute weekly huddle in person or video review meal logs, weights, and red flags. 2. A 1-page kitchen plan, fixed meal times, fluid thickness level, posture, spoon size, and a brief prompt script. 3. Escalation ladder and contacts when to call SLP-PMD. Phone numbers, criteria for urgent review. 4. Cultural respect, adapt familiar foods. G. Nigerian or Vietnamese dishes to safe textures. G. Finely mashed fufu with thick sauce. Preserving autonomy. Use the 2-choice rule: bean porridge or mashed yams. Praise small wins: you handled 5 spoonfuls on your own. Excellent. Honor the person's pace: short sentences, warm tone, pauses between spoonfuls. Practice supported decision-making, brief explanations, and accept a nod, decline. Helpful tools: wide grip, lightweight spoon, 2-handled bold rim cup, non-slip mat, supportive chair, dark placemat for contrast. Example: HOWA 74 after an SLP swallow assessment. The family moved drinks to slightly thickened, used a shallow bowl and small spoon. Each meal, HOWA chose spoon or soft straw, and the caregiver praised specific progress. After 3 weeks, cooperation improved markedly, cough on liquids decreased, and mealtimes stabilized at 25 minutes without agitation. Bottom line, when the team coordinates and autonomy is preserved, the person eats safer and better and, most importantly, feels respected with every small, dignified spoonful. When meals regain the right rhythm, right textures, and right roles, a person with Alzheimer's not only eats safer and better, they're respected with every spoonful. Start with the 3 pillars: swallow safety, dignity, adequate nutrition, keep a fixed routine, choose soft, protein-rich, swallowable foods, use small and often portions, layer reminders and hand over hand, follow the Dysphagia safety protocol, log meals, and coordinate the team. Every family is different. Adapt to culture, preferences, and swallowing ability. CTA. If this helped, please subscribe, like, and share so more families get timely support. In the comments, tell us your loved one's age and the biggest mealtime challenge you face. The Senior Wellness 365 expert team will suggest textures, menus tailored to you. Next video, a 5-minute pre-meal ritual that boosts focus and reduces choking.